mobilization of the elbow. Many times we have people with a fracture on supracondylar region. So this is a very sensitive treatment. We shall mobilize the elbow with the contractures which come due to the POP treatment. We shall mobilize it in a way that we are not pressuring too much the joint, the surfaces of the bones, that we stretch enough the tissue, but that we are not stressing that fracture which is maybe 6 weeks now and already a little bit stiff, but not so much. Because the problem is, if the fracture is close to the elbow while extending, the lever is so strong on the fracture side that we eventually, when it is not really nicely cured, we mobilize the fracture and not the joint. So therefore we have to be careful, and we have to start with the treatment of the soft tissue contractures. And normally we have it in here. As the elbow was like this in the POP for 4 weeks, or maybe 6 weeks, we will find the contractures in the tissue, the muscle with the tendon, and the tissue, the connective tissue next to the tendons, between the tendons, deep down in the joint, the surface and the anterior palmar surface of the joint. So I start treating the patient like this, mobilizing the tissue next to the ligament and to the tendon here. Little circles, and I'm going deep in it. It's a bit uncomfortable, that treatment, but I go in it to have strong stretching effect of my circling to this connective tissue. And I'm pulling it up from the elbow towards the shoulder. Soft tissue stretching as deep in as possible. If it is painful, I just do it gently and slowly. The direction is towards up here. A second intervention is I mobilize the tendon of the flexors. All the elbow flexure, they are arriving here, so I mobilize it. My movement is now like this. I'm deep in it, I mobilize from the outer side to the inner side. I move a little bit up to the beginning of the muscle, the fracture, and going down again until to the attachment of the various tendons here. Bicep brachialis and so on. I'm mobilizing these tendons. A combined stretch technique is I go deep in it, I pull the tissue towards the shoulder until I have taken off the whole slack, and then I'm stretching. Again, my elbow is fixing her shoulder. I'm going into the tissue, left and right of the tendon. I take off the slack towards the shoulder, and now I'm stretching in neutral position or in full supine position, or in prone position. Take off the slack and I extend. So we give a good stretch here to the tissue. For going on towards more extension, before I really do passive stretch of physiological extension movement, I'm mobilizing the accessory movement. That we can extend. Ulna has to go into the socket here of humerus. That means it has to glide down backward a little bit. I'm mobilizing this backward movement by pushing through ulna like this. I give a longitudinal compression movement like here, and I'm mobilizing the olecranon backward. So I receive a good stretch of the posterior part of the joint capsule, which allows that the olecranon is moving into its fossa. This accessory movement or involuntary movement, or called as well joint play movement, is necessary to have a physiological extension. So we mobilize first the tissue, we mobilize then the ulna, and when I can feel here with my finger movement is there, then we can go into gentle extension. When we are coming up to end range dysfunction, maybe here extension loss of 10 degrees, 15 degrees, I start to use combined movements. I go into full extension and I push through the joint with this hand here. I go through the joint and push it into extension, like this. We're careful with this intervention because it is very powerful, so tiny movement. Another stretch which helps for end range, I turn the hand like this, I flex it, and then I go into extension. Like this I can extend all wrist and finger extensors. And for a full extension in prone position, we need a good stretch of these finger and wrist extensors. I show it again. I flex the hand, I turn it into full pronation, I keep this flexion, I hold the elbow, and now I'm extending. That's all for the extension mobilization.